Okay, here we are. Thank you everyone for joining us today on the Zoom screen here to host an update meeting between all of our partnering organizations here in Fort Dodge and Webster County. And I'm just really pleased that everybody could get here today. We have folks from myself from the city, county supervisor, Fort Dodge Schools, St. Ed's, Iowa Central, Unity Point, Public Health, and also joining me here in the Fort Dodge City Council chambers are Senator Kreinbrink and Representative Meyer. So just a quick update from the city. We have sent out some additional press releases over the last couple of days, encouraging social distancing and stay home, stay safe, stay healthy, normal sanitation, normal operations within our Public Works Department, and our Fort Dodge Fire and rescue groups are implementing new protocols to deal with keeping their employees safe and also those that they serve safe. Same with our Fort Dodge PD. They're implementing some new strategies on how to keep their cars sanitized and keep their employees safe and deal with any type of transport they have to do. So things are going good with the city. We're meeting on a daily basis to try to keep communication lines open amongst ourselves. And it's just great to be here with all of you today to hear about your organizations and what's going on in our community. With that, I was gonna work through this agenda, which I have to move around on my computer screen here. I was gonna ask if Unity Point, would you be willing to go next and give an update? Leah?
Yeah, Matt, thank you so much for inviting us to be here today. We really appreciate the collaboration that we've experienced working with all these community partners to respond to this unprecedented time with COVID-19. I would be remiss if I didn't start my discussion today with a thank you to our physicians, our team members, and all the people that sit on our boards to help us really coordinate our efforts to respond to the disaster that we have at hand. They've just been amazing, doing a great job at the front lines and really leaning in to the things that we need them to do. So a big shout out first to those folks. I just wanted to say a few things about our preparedness and then also the ways we're decreasing exposure and conserving supplies. So from a preparedness standpoint, our incident command has been meeting for the past 4 weeks. We have a group of people strictly focused on our response to COVID-19. And so we've been working really hard to be prepared. I've told my team, and I will say it here on this, our community has been given the gift of time. And that has surely been a huge gift to us as we have developed surge plans for the emergency department and inpatient unit. We're able to plans to more than double our capacity should we need that to serve our community. We have filed for the waivers for the state to allow us to do that and are waiting to hear back from them, but we don't expect any challenges with that. We also most recently opened our respiratory clinic to help move the volume of patients seeking care for respiratory, to move them to our Second Avenue. Just call your doctor, we'll get you to the right place. As we've been saying in the past, call before you come. That's the most important message from us so that we can get you care in the right location. I want to talk about decreasing exposure in our supplies, really conserving supplies. That's a big topic that's been on the news. You may have read, we are postponing elective procedures. We're canceling non-essential clinic visits, non-essential hospital services. We've restricted visitors to our facility. That's been probably the toughest one for us, knowing that families want to be together, but for everybody's safety doing that. And then we've allowed a large group of our team members to work from home. So that has protected them for that. I think the biggest question I'm getting is do we have test kits and do we have ventilators? Seems to be the topic of discussion from a lot of people. I want you to know that we have test kits. We're testing people every day. Our clinicians are remaining vigilant of following CDC guidelines to make sure the right people get tested at the right time in the right place. We're getting results back every day, so that process is working really well. As far as the ventilators, we have increased our capacity, our supplies of ventilators, so that we can support the need. And the most important part to know is that being a part of Unity Point Health system allows us to get resources from different locations. And so what we might not have on hand today, we can get from our partners. We're also partnering with the 5 critical access hospitals that are part of our region. And so, they too have supplies that, we may need at some point. So we are ready, and our team has been working really hard to get us there.
Leah, one of the biggest resources, of course, that I think a lot of people are interested about, and it makes me think, what about your resource of people? Can you tell us a little bit about what you're doing with keeping your people in good health themselves and also in a positive way?
Yeah, thank you. That's a great question. Obviously, starting with our people, important to end with them too. We just launched a new policy where all direct caregivers are wearing masks at all points of contact. So if you're a direct caregiver, if you're coming to the hospital, you may see our caregivers in masks before they even come into your room, whether you have COVID or not, or whether you think you might or not. So we're using masks to test people we're using masks for all of our employees on the front line. And so that's really important. You may see when you come in partitions at the access points, whether it's with the pharmacy or in whether you're coming and if you have an appointment, our registration folks, we've put up barriers to protect them. We are really making sure they're staying informed. We think information is their best weapon to prevent them from getting ill. We're also doing things for mental health, like daily meditation. We just started doing meditations over the loudspeakers every morning. That's been really cool, well received by staff. And I think what's been most impressive is the change in our HR policies. We now have child care reimbursement available to people who are now spending more than they usually would because their kids aren't in school. We're doing we've changed our process surrounding low census time. So a lot of things just to help people keep their paycheck coming. So, and protect them from being ill and protect their mental health. So all of those things together, I think our intent is to really keep our team members supported.
That's awesome. Thanks for the update. A lot of good information.
Yeah, hey, thanks for letting us be a part of this.
Yeah, we appreciate the update. Up next on the agenda was public health, and our friends over there, Carrie Prescott's with us today. Hey, Carrie, would you give us an update?
Yes, again, thank you. I echo what Leah has said. We're very thankful for our staff as well, and we're very thankful to be part of the community to coordinate care and take care of the citizens in Webster County. So a quick overview of what we in public health are doing. Our agency is considered an essential service, meaning our staff are working to respond to the governor's public health declaration. Some of the activities we're doing is we're following our emergency plans that provide guidance for situations exactly like this. Our primary focuses right now are coordinating community services and monitoring the health of the county. We are here to provide accurate information. We have a Facebook page and a county website, or you can simply call our agency to get information and ask questions. We are making sure agency programs such as our WIC program, all of our child health programs, general assistance, family planning, and especially services to the elderly are available and coordinated in our community. We're monitoring the health of the county. We coordinate weekly with our partners, the hospital, medical providers, long-term care facilities, group homes, to follow up on any concerns that they may have. We're also monitoring the PPE needs of the county. We have called churches, daycares, social service agencies and organizations, schools, the community foundation to assure a coordinated delivery of services in our community. Unfortunately, part of our job is enforcement of the governor's declaration about closings and social distancing requirements. So we have staff that are connecting and contacting agencies that maybe need a little extra guidance on what this means in our community. That's what we were doing in our public health department. I want to say a shout out to our staff too. We have been working continuously, making sure that we follow through with our emergency plans. So.
Hey, Carrie, a question I'm getting quite a bit, and you mentioned social distancing as well as Leah did, and I kind of talked about it too. Is social distancing really working? I mean, is there a way you can tell us about social distancing?
That's great question. We're getting a lot of those calls too coming into the agency. They are. What we are doing is working. We may not see these results overnight, and we may see positive tests come into Webster County. We may see more sickness come into the county. You may feel like giving up, but don't. It will take time. My concern is in the next few weeks, we'll see people getting restless, thinking one quick get together or one quick play date or one quick visit to the store for non-essential items won't matter. But I'm here to tell you that they do. These quick actions to recreate a social network that we work so hard to instill in our community. We'll get the, if he can do it, then I can do it mentality. It will creep back into our community. What I want people to understand is it's normal to feel anxiety, discouragement, disconnected, and even being overwhelmed at times. This is normal in times like this. But the message needs to be you're not alone. Stay calm, remember to breathe, and to continue on. Stay strong, do your part in our community, take ownership, and just say, we got this.